She went to her doctor and said, I'm exhausted. I can't sleep. I'm anxious all the time. And I feel like I'm losing my mind. And her doctor handed her a prescription for antidepressants. She was 42. Nobody checked her hormones, not once. This is not a rare story. This is happening to women every single day. And it almost happened to me too. Today, we're talking about what actually is going on and why the answer is not in a prescription pad. Welcome back to In the Gray Area with Revv Health. I'm Britni.
And I'm Travin.
And this is a really good topic. It's one that's very dear to my heart because I have gone through it myself at a very early age too.
Yeah, it's a very serious topic, I think, and it should be taken seriously because you said in your intro, it's not rare, and it isn't at all. And it happens to women every single day. I mean, I think probably, with our age group, like we're in our early 40s, and I guarantee you that more women we know than not, this has happened to.
Yeah, absolutely. I mean, I was 33 when I started having all these symptoms. So it's an earlier age than we see. Sometimes we do see that.
Yeah.
But, going from doctor to doctor and being told basically that I'm crazy, that was really, really hard to go through, especially like when you're looking for help, and you're so desperate.
Yeah.
So, I mean, we see that all the time where people come in and they're like, yeah, they tried to give me antidepressants, and it's just one thing after another. And that 9 out of 10 times is going to make it even worse.
Yeah, it is. And it's like, and I want to say that it's not, I don't want this to be about just a complete knock on antidepressant medication, because I do want to say I understand that there is a place for that. And there is people that probably truly need that maybe at some point in their life, if something like, dealing with something or whatever. And so I'm not just completely want to dismiss that for people. But as we talk about all the time, that a lot of these symptoms that are associated with depression are the same symptoms that occur with low hormone levels. And that happen as we age and we see a decline in hormones. And so I think that it's almost like malpractice in a way. If a woman comes in and they're describing these symptoms, like you should automatically be checking the hormones in the first place. But the problem with that, as we know, that still is not going to get them the help that they need from their primary care doctor, because they're going to check their hormones and 99 out of 100 times they're going to say, oh, everything looks good.
Yeah,
when we know it's
normal.
Not. Yeah.
It made me think though, like that's really sad because 9 out of 10 times for women, we're going in after we give childbirth and we're just saying, I don't feel myself. Like I should be happy. I have a new baby, and it's like, they should know the whole process of how our hormones work, during pregnancy and right after pregnancy. And instead they're just handing out prescriptions like it's candy.
Yeah.
Instead of, we see women come in with these same issues and, we'll see that they need some progesterone first and foremost, and that will make a huge difference. Or even taking a look at thyroid and stuff like that. And what going through childbirth actually does to our bodies, like it's significant.
Yeah. Well, it's a combination of a lot of unfortunate situations, but it's guidelines, it's time constraints, it's what they're taught. It might be just flat out laziness. It might be ignorance. It might be lack of training, but there's a constellation of things that go into why this is occurring and why they're just getting handed a prescription for an antidepressant or an anti-anxiety medication rather than diving in deeper and treating something like hormones that will improve all these symptoms, but also it'll improve their overall health too, versus as we know, like a lot of these medications, they come with negative consequences of, at the expense of someone's health. And so it should be a no-brainer, but it's not the way that our healthcare system works.
And I know that when I was sick, I was working with my midwife, who I love, and I've worked with her. She's delivered my children and stuff like that. But I asked her to take a look at my hormones, and she hardly looked at anything and then just told me everything was normal, So, I mean, she didn't even look at testosterone for me. And so she pulled up TSH and progesterone.
Yeah.
And it's sad because like you said, a lot of times it's based off of, what they were taught. Yeah. But to a certain extent, I think that it's time to start questioning things when we see this pattern and these habits over and over and over again. Yeah. Or even like when we have that one patient that came to us and she's optimal and she feels amazing. She went to go get a pap smear and they told her that they will not treat her anymore because of where her hormones are at.
Yeah.
It's sad.
It is sad. It's
instead of like being excited that she feels amazing and that she's doing so great,
Yeah. Well, we talk about that all the time. It's so ignorant almost that it's completely ignoring the patient's actual health. And they're like focusing on something like hormones or a level of hormones and like letting that completely dictate like their thought of that person or how they treat that person or like their overall state of health rather than like all the actual health markers that they should be looking at.
Absolutely. I think we can agree that we're seeing like younger and younger women come into with these issues. We've had 15-year-olds with extreme anxiety and stuff. But like even going back to my own daughters, you know, it's sad to see them like this generation of how much depression and anxiety there really is. And when we take a look at their overall health, like my daughter looks healthy, but her hormones were tanked. And then adding in some testosterone and progesterone, she's not having anxiety anymore.
Yeah. Yeah. I mean, that's the answer most of the time, you know, is fixing these hormone deficiencies, and things like testosterone and thyroid do a fantastic job at improving symptoms of depression in someone's mood and overall well-being. And it's, you know, the psychiatry world, believe it or not, has been using like high dose T3 thyroid hormone for a long time. I mean, they started this a long time ago in treating depression with thyroid hormone, and it had nothing to do with lab work. They didn't look at lab work. They literally would give the hormone and they would increase it until those symptoms improved and went away. And, you know, I talk all the time, like that's how hormones like thyroid and testosterone should be treated in general. Like it shouldn't matter what the lab says. You just titrate to effect. But you know, it's just, they've been way ahead of that game, but most people and most women are not going to get treated with those hormones for symptoms of depression.
That reminds me of like one of our female patients. She's a counselor. She sees many patients that come in, and she started with us. And then she started referring her patients to us. And she just sent an email in just telling us about the experience that she's had, that they've had, and how life-changing it has been for a lot of them. So that's really cool to hear and get that feedback from somebody like her too. Yeah.
That, like I said, again, going back to that world and like, you know, counseling, therapy, et cetera, you know, I feel like a lot of them have been kind of ahead of the game in terms of hormones, because I think a lot of them realize the importance that hormones play on these symptoms, even more so than a lot of just primary care doctors in general. And so, as we know, you're not going to typically get the help that you need in terms of like truly treating the root cause for those kind of symptoms. But it's just, I mean, it's cool that she said that.
It kind of feels a little challenging too, that there's so much more information out about hormones right now. Yeah. Because people don't understand the difference between working with people that specialize in it and getting compounded bioidentical versus like going and working with, you know, your OBGYN that just gives you a script for the commercial grade. And, you know, there's a huge difference between the two.
Yeah. And I feel, and that's why a lot of people still probably won't get symptom relief traditionally, because they're just not being treated optimally enough. Like, as we know, I mean, let's say like primary care had the foresight to treat someone's depression symptoms with thyroid. They're still probably not going to treat them to the level that person needs to be at to totally get that symptom relief, you know, because we see like we treat T3 pretty high, right? I mean, to get symptom relief in a lot of people that would just never fly in a conventional setting. Not
only that, but they don't even test for it. So all they're testing for is TSH, and they just see that it's extremely suppressed, and they freak everybody out.
Yeah. So I mean, it's sad, right? Because how many women have you worked with that have stopped taking their thyroid because their doctor freaked them out, when you know that thyroid is what they need the most, and that thyroid's going to help them the most with the things that they need, but they stop taking it out of fear of a primary care doctor.
Way too many than I can even count.
Yeah. It's sad though.
It is really sad.
It's crazy. And it's just like, I wish that, I wish those people would trust the process, but you can't help them. And like we say, like you can't ride two horses and you have to pick one. And so if they come back and say, my doctor says, then we're done.
It is interesting though, like, because we've done this for quite a few years now, like personalities and people and stuff. You can tell right off the bat, people that have, gone already doctor to doctor, they've tried all those things and they still feel horrible and they're desperate and they want, and they're totally tuned in and they're willing to try anything and they trust the process and they'll reach out and check in and stuff, but they're not going to Google. They're not going to go ask their friends for advice. They're not going to go ask every doctor under the sun. And there's a huge difference on the outcome of treatment.
That's what I was just going to say. Yeah.
Huge.
It is. And I mean, those people, like, those are the people that come back and they'll comment or say that it's life-changing.
Yes.
That it completely changed their life and that they went from here to here because they trust the process, but it does take
time.
It takes time, and it takes really optimizing levels. And like, I can't stress that enough. And I stress it all the time, but it's like, there's a difference between just hormone replacement and then optimization. And, there's such a fear, either a fear or a lack of understanding with the rest of the medical world of really optimizing levels. And so, what I mean, like, most people just don't get to where they need to be at because they don't optimize their levels enough.
100%. And I think that that's one of the biggest mistakes I see with people is they're too scared.
And yes, it's been so stigmatized with this fear around hormones. And we talk about the bioidentical and synthetic differences all the time, but there is no harm that bioidentical hormones are going to cause someone.
Yeah. And that's just like, we talk about people like, okay, well, what were your levels at like this age? And your body wasn't like working against it at that time. It's not going to be working against it. It's not dangerous now versus then, but it's really, really hard to overcome, especially with the Women's Health Initiative, which we know now is the worst study ever, but we're still dealing with residual. We have people like my grandmas that they never got the chance to optimize their hormones because of that too. So it's really, really sad. There's a lot of women out there that are miserable.
Yeah, for sure. It's interesting with when you get those patients that you just talked about that they have been dealing with a lot of problems for so long and they've seen so many different people, and then they come to us and they start working with us and they work with you, but then they'll hear something else over here and they'll want to completely change course, or they'll stop, or they don't want to trust the process. And it's like, what is the definition of insanity? And it's like, literally, it's like you keep doing the same thing over and over and over again and keep bouncing around and nothing ever changes. And it's like, I feel bad for those people, but I don't at the same time, because, at some point you have to make a decision to follow through with something.
Yes. It goes back to being accountable for yourself.
Yeah.
I think what's interesting too is that I just had recently, happens all the time, where somebody has had recent blood work and they want me to take a look at it to see if we can use it. And there's hardly any hormones on there. And it's like, people need to understand that it needs to be more comprehensive. What we're looking at is like LH and FSH. We're looking at progesterone. We're looking at total and free testosterone. We're doing a full thyroid panel. So all of these things are really important for everybody to be looking at. You cannot base something off of just total testosterone and TSH and progesterone.
Well, that's the thing. It's like it's not necessarily basing it off of it, but they'll use those numbers to restrict someone's therapy. It's like, we always talk about, like, we could treat testosterone and thyroid without even looking at labs ever, but they will use those. And what I mean by that is they will use a TSH to restrict therapy. They'll use a total testosterone to restrict therapy, because they'll make sure that once it's in the normal range, you don't need any more than that. And so they'll restrict it. You can have more. And it's like, we did an episode a couple weeks ago talking about like optimal hormone levels. And there's so many comments in about how, my level was here and I felt great and my doctor reduced my dose and now I feel like shit again. Or, like, there's tons of comments about that. And it's so mainstream for that to occur. And these doctors will just randomly pull someone's dose back. It's not even that high. It'll be like 1,100, 1,200. And the guy will feel great. And then the doctor pulls it back because they're like, oh, I want it to be at like 800. And it's like, that's not based on any sort of evidence whatsoever. But it's like this whole fear-based agenda that, okay, we can't let this guy's testosterone get too high.
Yeah, it happens all the time. But even for our females too, I think people are blown away when we talk about like my levels, but understanding that I didn't get here overnight. But also it's really, really important with a female, as we're raising testosterone slowly, that they have adequate amounts of progesterone to help, because it makes a huge difference when it comes to like that irritability that females can get, especially if titrating too fast.
I think that's super important for women to know and understand, that just like men, like, they shouldn't be afraid of a particular number, or they shouldn't worry about a particular number. Like, if you're getting side effects, then of course that's something to deal with. But just to, we've had women that are thriving at like a very high number. And then they get labs done and they see that number come back and they freak out.
Yeah.
And then they want to drop it way down. They think that they're going to, turn into a man, or they're whatever, grow a beard, or voice is going to change. And it's like, there's so much fear. Like I see people on social media all the time talking about how, women need to stay in this like zone, this sweet spot of testosterone, because like once you go above that, you start getting like virilization, and you got to be super careful. And I see it even coming from like the bodybuilding world a lot. And it's like, just wonder like, okay, how many women have you worked with and treated with bioidentical testosterone, and not like all these synthetic compounds that you use in the bodybuilding world, but with just testosterone, because you can go super high with levels and women don't get manly features at all from that.
That reminds me of one of our female patients that's been working with us for like since the beginning. And she started with injections, and then I talked her into trying the cream, and she liked it, but she was super scared of how high her levels were getting.
Yeah.
And her husband works very close with another guy in more of like the bodybuilding world.
Yeah.
So he's telling her that, you don't want to get over this number for testosterone. I'm telling her like, how do you feel? She's like still complaining about mood and libido.
Yeah.
So I'm encouraging her, but then he's freaking her out. It was like this huge like cluster. Well, then she didn't want to tell me, but she was getting an IV down the street and had blood work done. And that person has gone through one of the World Link training and looked at her blood work and was encouraging her and explaining the same exact thing that I did to her. And so then she called me to tell me, and she was embarrassed because she didn't want me to think she's going elsewhere. And that wasn't her intention, but she got reassurance, because hearing what we say is completely opposite of what they're going to hear anywhere else.
Yeah.
So that can feel very overwhelming and kind of scary especially to women when we're telling them something completely different than what they're hearing everywhere else.
Yeah. Well, again, if you go back to like, what do the studies say? And we've talked about it before, but it pretty much is a level of 300 is where, the women start getting, all symptomatic improvement. Is a testosterone level of 300. And so, which is quite a bit higher than what typically you see on social media when people talk about it. I swear I see this like 70 to 80 or 80 to 100 like range that people talk about all the time.
That's what I thought before I knew any different. So I understand. I think it's just what is constantly being put out there. Because I know mine was like 29 and we were trying to hit like 90. It's like, I don't even,
just
this was a long time ago,
number.
but So, more than anything, I really want women to understand that they're not alone. And it's something that is so common that we hear all the time. I have women reaching out and like, I just haven't felt myself forever. My doctor says I'm normal, so more than anything, I don't want other people to feel like I did, because I just felt like I was going crazy.
Yeah. I think the main takeaway is like we talk about all the time, like normal is one of the most dangerous words that we hear, and because it gives, people think that they're okay. And like you drove yourself crazy because everyone keeps telling you that you're okay. There's nothing wrong with you, but you knew, like, your body, and that something's not right. That you feel off, that you don't feel the way that you should be. I think a lot of times we just chalk it up to aging, and I have to accept that I don't feel as good. I have to accept that I don't have as much vigor. I have more fatigue. I have, my libido isn't where it used to be. It hurts when I have intercourse, like all these things that it's like, I'm just getting older. And there's an exception that goes there. But as we know, like optimizing your hormones and doing the lifestyle things, and you can thrive and well into old age.
And that's some of the like most exciting things I see with our patients is like when they're older and they have like gone through that sadly, but then when they start addressing hormones, especially together as a couple, like them coming in, like just so thankful on how much it has improved their love life, just like the quality of life day to day and stuff. It's pretty incredible.
I think that's a great like example of showing that it's never too late. I mean, it's like some of those couples you're talking about are like in their 70s and it's like they get on hormones for the first time in their 70s and it's completely life-changing for them. And so I think we should kind of tie it back into like the original topic about women and depression and fighting against those symptoms and trying to get the help that they need. And so, what would you just as kind of like a recommendation to women that are struggling with some of these symptoms, like ultimately do?
of course, everybody is always welcome to come to us. It's really simple process. Our website, you can just go to Start Now, and there's an intake form, and somebody from our team will personally reach out and ask some questions to get some blood work ordered.
Yeah.
If you've had recent blood work, we'll take a look at it. 9 out of 10 times, it's usually not enough, but we try to make it as affordable as possible. Like for our females, $250, and that's the comprehensive blood work panel, and then a consultation with one of our providers as well. So if it's not us, I would just make sure you find somewhere that they are WorldLink trained, or that they at least specialize in what they're doing. But I also want to let people know that 9 out of 10 times insurance is not going to cover what you're looking for.
No.
Otherwise you're going to stay within those guidelines that we always are talking about. And it's
not going to be effective.
No,
it's not going to be effective when you're staying in those guidelines. And I think, everything you said is correct. But I think just, when you're dealing with those kind of symptoms, like always you should be checking your hormones and trying to work on that before you go down, the medication.
Absolutely.
Route.
Yeah. And I tried. I did. Like after having the twins, I was so extremely depressed, and they just gave me like one antidepressant after another. And then that spiraled. Like I remember like even going out and having some wine and like feeling like I black out because I'm having, there's just so many bad things. Yeah. It never works out for the best. Yeah. But we've seen that even with men. So it just seems like it's so easy for them to just pass it out like candy. Yeah. And
it's the easy fix.
Yes. And unfortunately, I feel like I've actually experienced so many different realms in them when it comes to, health issues between having kids and my hormones and then breast implants. And so I've seen it all. Yeah. Yeah. But I think this is really good for a lot of women. I think they need to hear that first and foremost, they're not alone. I think that a lot of women just feel like it's not as common as it really is. Yeah.
Well, it's like you see the desperation in so many women that come to us, and it's sad. And it's like, on the flip side though, it is amazing when you can really help them and you see them come through on the other side, a completely different person, and say that, it's life-changing. And so it's like, that's super rewarding.
Yeah. And we do see it a lot. So it's not as common that we see these women that, are going all over the place and looking for other opinions and stuff outside of it. But there's a lot of hope for a lot of people.
Yeah, for sure.
So like always, I want to thank you for joining us today. Please like, share, comment, and subscribe, and we'll see you next time. Thank you.